Hello everyone, how are you? Here another question for MRCS, which is important for MRCS exam, and it will help you to participate in MRCS exam and pass the MRCS exam very easily. We will discuss all the eMRCS question, Fawzia sheets, and recalls according to you can pass the MRCS easily. If you are a new visitor in this YouTube channel, subscribe the channel for all of the new videos, and we usually deliver about 2 videos in every 24 hours. So subscribe our channel and stay tuned with us. So here the question: a 54 years old man who has end-stage diabetic nephropathy is being assessed for renal transplant. When assessing the HLA matching between donor and recipient, what is the most important HLA antigen to match? So here we can see a 54-year-old man, and he is at the end stage nephropathy and going for renal transplant. And when assessing HLA matching, HLA matching between donor and recipient, which is the most important HLA antigen to match. There are different type of HLA antigen to match before transplantation of kidney. Among them, which one is most important, or which one should not be neglected? Because if the mismatched HLA kidney is transplanted from the donor to the recipient, the transplantation failure will happen earlier. So here we can say the options are DP, B, DR, C, and A. So before transplantation of any kidney, we have to first match the HLA typing, and before that APO group is very important. Then HLA matching. Some of the organ only blood grouping is enough. Some of the organ there is no need of even blood group. But here in case of kidney, HLA matching is very important after matching of AVO. Then here we can see the HLA antigens. Here are HLA antigens usually classified into 3 groups: class 1, class 2, and class 3. Class 3 is usually not important, so they are not in discussed. So here we can see class 1 HLA antigen and class 2 HLA antigen. In case of class 1 antigen, they includes class 1A, B, and C. So in the class 1 there A, B, and C. And we can see the class 2. The class 2 includes DP, DQ, and DR. So in case of HLA, two important class 1 and class 2. Class 1 is A, B, and C. And in case of class 2, they are DP, DQ, and DR. So in HLA, these 6 lines is very important, because A, B, C they are included in class 1, and DP, DQ, and DR they included in class 2. So here we can see the HLA matching for renal transplant. Importance of HLA antigen are as follows. They are first of all DR, then B, then A. Among the here the 6 important character, among them most important are first of all DR, then B, then A. So you have to remember that DR it is class 2 HLA antigen, B it is class 1 HLA antigen, and A it is class 1 HLA antigen. And the sequence most important is doctor. Dear doctor is very important for any nation, any country, for anywhere. So doctor is very important. So in case of HLA matching during kidney transplantation, doctor is very important. So this point we have to remember anyhow. For kidney transplantation, DR antigen or doctor antigen, we can remember it by doctor, but usually it is not doctor. So DR or doctor, it is very important for HLA matching during the kidney transplantation. Then B, which is in the class 1 HLA antigen, and then BA. We can see, we can remember by the another way that BA, it is another degree worldwide. Doctor BA, doctor is a degree and BA another degree. So doctor BA or DR BA, this sequence. So we have to remember by this sequence, and these two lines, class 1 antigen, class 2 antigens and their component, they are very important for HLA. During the study of HLA, this point is very important. Class 1 included A, B and C, and class 2 antigen include DP, DQ and DR. So here DRPA, or most important is doctor, or second important is B, and third important is A. In the short, we can remember by doctor BA, two separate degree. Doctor is a degree, BA another degree. By this way we can remember it very easily. So here the our final answer is doctor BA or DRAB or DRAB DRAB. We can say or DARVA, DRVA DARVA. So the sequence is D R B A, DARVA or Dr. BA or anything. This sequence is very important, and it is also important for MRCS exam. So finally our answer is DR. And we can see here, if we read the question again, a 54 years old man who has enlisted diabetic nephropathy is being assessed for renal transplant. When assessing HLA matching between the donor and recipient, what is the most important HLA antigen to match? The options they included DP, B, DR, C and A, and we know that the A, C and B, they are included HLA class 1 antigen. On the other hand, which starts by D, such as DP, DQ and DR, they are HLA class 2 included. So our final answer, the most important HLA antigen to match, this is DR. Thank you all. Be okay. Stay tuned with us, and we will try our level best to help you for pass the MRCS exam. Thank you.